our first session of training, particularly for our technical staff. Obviously, our doctors are welcome to join this series. Today, we are beginning our first, lecture. It's an exciting lecture, which is the important part in all the industries. That is communication skills. And my dear friends and colleague, Dr. Preeti and Santwana are the showstoppers, and they are basically starting this. So over to Preeti, who is a fantastic, first of all, moderator, who will be, shouldering this responsibility with Santwana. Over to you, Dr. Preeti.
Good evening, everyone. So today it gives me immense pleasure to be here and moderating the webinar on quality for all and begin with communication. And about Dr. Santwana, I would like to say she's really an accomplished person. She's done Masters in Science in Biochemistry and has a doctorate in Management Studies with specialization in Pathology Lab Management. And she's an international lead assessor, ISO 15189-2012, and lead auditor also for ISO 9001-2008, and NABH principal assessor for lab program, and also for pre-entry level for NABH certification. And she's a Six Sigma Green Belt in hospital and healthcare, certified lead auditor ISO 9001-2008 from British Standard Institute, and also associate member Australian Association of Clinical Biochemists, certified trainer by NABET and trainer NABH pre-entry level. And the main thing is, like, she has got over 20 national and international awards for quality in healthcare. And Dr. Santwana has done nearly 1,000 training sessions over the last 4 years on quality and patient safety in hospitals and laboratories. So now we have this webinar, which Dr. Santwana is the speaker of. Quality for all begin with communication. And we all know that effective communication between the staff members and patients is so important, not just in today's time, but since times immemorial. And so many lab errors, they can be prevented because of, and medical errors can be prevented by effective communication. And this good communication always will ensure better, like, healthcare and also ensure patient safety. So now all over to Dr. Santwana. We welcome you, Dr.
Thank you so much, Dr. Preeti. And welcome to all the participants and my dear panelists. I take this opportunity to thank CAHO, the entire team CAHO, and our chairman, Dr. Vijay Agarwal, our general secretary, Dr. Lalu Joseph, and the CAHO Diagnostic Division chairperson, Dr. Seema Bhargav, that they have given me this opportunity today. Dear friends, I would be talking today on communication, basically in the diagnostic field, which includes the laboratories, which includes the X-ray sonography centers, the CT scan centers, and what are the issues that can take place. So what exactly is communication? We always keep on talking about that, yes, we had communicated. Now, if there is any kind of an exchange of either words or in something in writing, which is used to impart either knowledge or to inform a person, then this is called communication. So it's a medium, basically. So these medium of connecting people or connecting their thought processes is what is important in our today's setup. Now, there are generally 5 types of communication that we talk about. And these communications, since you know that we have our 5 senses. So these senses is what helps a person to understand that what is being conveyed across or what is going to take place in the near future. How is it going to help understand a particular situation or a particular topic. So here what we are talking about is the verbal communication, a non-verbal communication, a written communication, either by listening and of course visual communication, because visual communication also mentions a lot of things. You would see it in one of those videos wherein the expressions of a person conveys a lot of things to the person who is the receiver. So whenever we talk about communication, there are two people who are involved in this. There is one who is either the provider to a provider. Okay, so in such a place, like I am the provider from a laboratory or a diagnostic center, and my the person who is either the reception or in the phlebotomy area or the CT scan technician. So the communication between these two people are going to be totally different from the provider to the patient. Okay, whenever we are talking about the provider to the patient, it has to have a lot of soft skills. It needs to have a lot of empathy in it, and that's how it makes a lot of difference in increasing the business and improving the work conditions. And the third is internal communication. Now these internal communications can be in different form. It can be in forms of most of us are now we are having the WhatsApp groups and all, so we are communicating through it. There are many times that even on a WhatsApp message, we are having the audio messages which are recorded, or we are having some videos which we are sending. These are the communication modes for the internal. Now, whenever we talk about communication, there is the 7 C's of communication. These 7 C's are, number one is the content. Content is very important, because if we start blabbering about, or we start talking about some things which does not have any solid base in it, what we call the content, then it is going to be very, very difficult for the person in front to understand it. Now, for example, when we had put up these web series, this particular webinar, the first webinar, and we mentioned about it, you could see it, the content, or the or what we call in Hindi as Vishay. Vishay means the topic. Now, once you know what the topic is, people will understand or grab information on it, that yes, we are going to we would be speaking only on this specific topic or this specific content, and we would get knowledge or understanding on this particular subject. So the content is, whenever you are taking it as a context, that's actually going to be the fourth one. So this content needs to have a context. Context means whenever there is whenever you're going to put up a kind of, you can say, a presentation, or when you're going to have a discussion even internally within your organization, or you're having a discussion with your patient, in that case you cannot talk something which is irrelevant to the situation. So the content, if for example I would say that if a person is coming for say a particular investigation, and that investigation is not a fasting investigation, it can be a routine investigation, say it would be a CBC, okay, or it could be RT-PCR, but you are talking about, are you fasting? This content is not valid for such a situation, and the context is also not valid, because it does not make any sense to the patient. And if the patient has even a bit of knowledge, it would show that the organization does not have a basic understanding of what are the investigations that need to be done. Okay, even if you go for a radiology setup and all, or if you go for CT scan, if the CT scan does not have a contrast, you need not ask for a creatinine, a serum creatinine. Even for a routine investigation, if they are coming and you are asking for serum creatinine test results, the patient goes back to his GP, and then there would be a query that most probably the people in this organization do not understand. So let the content and the context be the same. There has to be continuity. The continuity of a particular discussion is, if I'm right now talking to you, say on communication, and I suddenly go into a totally different field of quality in the internal quality or IQCs and ECAs, there is no continuity of my communication process that I'm talking to you. So I need to focus on whatever subject that I'm speaking. So continuity or nirantara, that means nirantar in Hindi means that it has to be in a continual process. The subject has to be remain the same, and that's how you can go ahead. For example, if I would say that a person has come for say the blood sugar fasting and a lipid profile. So whenever a technician or a doctor or the medical professional, whoever is there, is asking a patient that, are you fasting? If the patient says yes, then you can continue and go ahead and saying that how many hours of fasting, whether the person has had anything after that, because many a time fasting is considered in many places as something wherein you can have potatoes and sago, and you can have some lemon juice and all, nimbu pani, and that is fasting, because fasting has a totally different meaning in the general word. So continuity of that particular session should include whether the person is achieving whatever is the basic requirement for that investigation. Clarity has to be there. That means you yourself, the person who is going to speak, whether it is within the two people of an organization or it is within the person and the patient, there has to be a clarity of whatever the message that is needs to be communicated. Clarity in terms of there, I would later on take it that in verbal discussions, in verbal communication, you should not blabber, you should not utter words which are in either jargons or it should not be in abbreviations, because there are many people who do not understand. So let us be very clear in whatever the spoken language is there, especially when you are connecting to your client. The internal customers are different and the external customers are different. So whenever you are communicating, it has to be very specific and clear. The message needs to go that shows that yes, this particular information has been passed. Now the channels or the medium, there are many channels and mediums. The channels can be either talking between two people, okay? The channel can be communicating via say phone or by cell phones or by fax, by emails. Now these communication channels need to have a certain information which goes only as per the requirement of that particular communication method or the content. Okay, for example, when people are writing mails, okay, now in mails people start writing a lot of things. They would start with introduction, they would start with talking about something, then they would go ahead, they would discuss about irrelevant things. Now it should not happen that when a channel of emails is taken, then there is no clarity on what the subject is, there is no context to the subject. The content is, I would say the content I like is introduction to business, okay, or to the particular business or your reports. For example, if someone is sending the report, now if you're sending this report, it has to have the report which is attached, okay. It can also have a context to it saying that your blood sugar fasting PP reports are attached here with. But do not take it to a level wherein if you would like to do a lipid profile or we have your blood, please, if you want to get investigations done, please come and connect to us. These things should not be added onto it. Now, when these things happen, the credibility of the organization goes for a stake. Why? Since I was giving you this example, that if I mention it in my email or in my WhatsApp, saying that we have your information or we have your database or we have your sample even more, the organization will be question marked for the confidentiality, whether they are maintaining it or not. So the credibility of the organization goes down. So whenever you're taking these particular say 6 parameters right now, you should take it into a context that the confidentiality of the patient or the person who is going to inform, the person who is going to receive, is maintained, so that a person, whenever there's any kind of information which is being generated and it is being received, this communication is taken care well of. The last but not the least that we talk today about is the capability. Capability is if I keep a person at the reception area who is not competent enough or capable enough of communicating with the people who are coming outside, either due to some barriers, which we are going to discuss later, but the general barriers at the reception area or the front desk or the phlebotomy areas are the soft spokenness, empathy towards the patient. If these things do not take place, then the communication is not very good. And there's where the question mark on the organization takes place. We go to the next slide where we talk about that for essential patient services skills, what are the good communications skills? Now, whenever I was just talking to you about empathy. Empathy means putting oneself into the condition or the state or what we call the shoes of the other person. A patient who comes to you is generally not a very, very happy person who's coming, has a lot of negative things that are going on in the mind. And this is when the patient's reactions are totally different. We would just be seeing after this slide, we would see a small video on how a very irritated, I would say, customer comes or a patient comes, and what happens then when the person who is there at the reception or at the phlebotomy area, when they respond, what happens and how it creates either a chaos or it creates wherein we lose the business for that particular patient. Now, strong verbal and non-verbal communication skills are must. You should know and you should be able to work in teams. Whenever you are working in teams, like for example, I would talk that in case of team, if there is a patient who is on a stretcher, now on a stretcher or say on a wheelchair, we need to have from the front desk, the communication to the team should go that the housekeeping people should be there to shift the patient to either the CT or the MRI or the X-ray center or to the phlebotomy center. At the same time, the phlebotomist needs to be told the collection is going to be for this specific person. It should not happen that the patient has to go at each and every place and go on speaking or telling that I have to get these things done. So when you work in teams, a good communication is created. Leadership skills. Now this everybody needs to have. We are going to have a very separate session on leadership skills in this platform of CAHO only, wherein how one can take the lead. It is not necessary that there should be a person who's a manager who can take a lead, but all of us should have that quality of taking the lead and getting the whatever processes which are required to be done. Decisiveness. Decisiveness is very important. When you see the videos that is going to be put up, it shows that because of the indecisive nature or the indecisiveness that has been inculcated as a culture in that particular organization, one person means one person has actually left from the area, saying that it does not work, because if any organization does not have this kind of the attitude of positivity and giving some kind of a firm answer, then it does not make sense, because you never know what is the kind of a report that is going to be received. And of course, an ability to work under pressure and time management. So this shows that there is already a customer who's come, who's not a very cooperative customer. She comes and she is attending, and you see that see the gait or see the posture of the person who is sitting at the front desk. She's also doesn't seem to be bothered about it. She does not even, I would say, not even wish. There is no greetings. There is no acknowledgement. She is not even asking the patient as to what exactly are the requirements. The patient is irritated. When she doesn't get an answer to her queries, or there is no resolution to her answer, the questions that she has asked, she walks away from there. Now, whenever we talk about verbal communication, whenever we are having actually a effective communication, what could be the benefits? So let's first talk about the benefits. Benefits are trust. Once you have an effective communication, if I can convey across to you about what is there in my mind, it builds a trust between you and me. So this kind of a association helps in a long-term commitment with the patient and the organization. It helps in team building. Whenever you're working in a group or in a team, when your communication is according to the 7 C's that we have talked about communication, then a team becomes stronger, because then there would be less of conflict. Better relationships, no conflict, no bitter relationships in any organization. There would be increased job satisfaction, because whenever there is a good communication, there's a positive communication. If there are any kind of issues that are taking place, if these are conveyed across and amicably sorted out according to the context of the situation, then there is an increased job satisfaction. Increased productivity engagement. That means whenever there are people who are going to be involved into such activities, they have the productivity for them which goes on increasing, because the positive environment takes place. Problem solving. Whenever there is a communication issue, there are always problems that take place, whether it is in your personal life or in your professional life. It is very important to communicate whatever the situation is. There are many a times that people take back things, hold it on to themselves, or they communicate to a person who cannot actually be a member or participate into the problem solving activities. So effective communication needs to be, when, as I spoke about the three methods, or the provider to the provider, whenever their communication has to be conveyed, it should be between the two people who are connected to that particular problem. And while handling conflict is very common in workplaces. The conflict can be easily resolved if the communication is proper. There are many incidences, even in my own career, throughout my career, but I've seen that whenever there was a conflict, if it was discussed amicably on the table or sorted out, rather than creating issues one by one or conveying it to someone who adds on to this and conveys it in a totally different manner, what we call the Chinese whisper, then there is a lot of conflict. So to handle conflicts, an effective communication system has to be there. Now, the communication are basically more important if in our this thing is on the verbal communication and in the non-verbal and the written communication. So in verbal communication, we have both spoken and written words. Okay, written words means you are repeating it, or you are pointing out, or you have some kind of a gadget which tells you. Like whenever you are at a railway station, there is an announcement which is taking place through an automated system. Now, if today I start talking in a language which is not understood by any one of you, I say in Marathi or Gujarati, then the communication that I would like to give to you would not be received by you. So verbal communication has to be in a language. Okay, there has to be a pace. Pace means the spacing between the words, or the pause between the words and the sentences. So this spacing has to be there. The annotation means whenever your tone is either increasing or decreasing. Whenever you are into a low mood, your tone goes down. Okay, whenever you want to speak to someone who is elder to you or you respect that person, your tone is slightly on the lower side. But whenever you are in a mood to either fight or create any kind of a issue, then the tone goes high. So these kind of verbal communications make a lot of difference in what are you and how are you communicating. You could see in that particular video. I'll just show you another video after this particular slide, wherein what is the expression in verbal communication to the patient and from the patient to the provider. There has to be clarity. So verbal communication has to be clear. It has to be very specific to the subject, as we have discussed in the 7 C's. The timing in sense of that it should be at an appropriate time. Example, a phlebotomist who is going to tell a patient that she is going to prick. If she tells it in the very beginning and the patient is not prepared in the prick, maybe the patient would not appreciate it and would at least express the pain or the discomfort. And of course, the verbal communication has to be relevant. Can I request Komal to please show the slide 2, the video 2, which shows about the communication, the bad communication between the patient and the phlebotomist. You can see the expressions, less of words and more of expressions of discontent, discomfort, disagreement. The patient is not actually liking the way the phlebotomist is behaving. You can see the way the phlebotomist is grumbling while the patient's sleeves are being folded up. You can see the anger in the patient because so here you see that the patient walks in, already the patient was upset. Okay, she comes in, the phlebotomist does not even acknowledge. There is no verbal communication between the phlebotomist and the patient. The name was never asked. The TRF was not even read through properly. The patient wasn't fasting, was never asked for that what time has it been taken. So these are all these communication gaps that lead to a lot of discontent in the client or the receiver. Now, the second thing that you saw is the phlebotomist was trying to move a fidget with a needle, wherein the patient was in pain. So rather than comforting the patient or discussing or telling her the patient that she has to do it for the sake of getting blood, the technician was getting even more upset or agitated with the patient. So this only led to discontent between both the receiver and the provider. So it should not happen that whenever you are communicating, there is a gap. So this is one more important thing that you need to take care. Now, non-verbal communication, when we talk about the gesture or what we call the hav-bhav, that is the expressions. Okay, the way you are standing, the way you walk in, the way you look. So there are many times wherein you wish or you greet, you give a smile on your face. These things are communicating to the person in front, saying that yes, you are welcome. So your gesture, your facial expression, the posture where you sit. In the first video, you have seen that the posture and the gait of the person who had come over there for investigation, and the person who was sitting at the front desk, it was totally mismatching. The person in the front desk was actually busy on the cell phone, was not interested, and she also, I think so, wanted that as soon as this patient goes, I can get back to whatever I was fidgeting with my mobile. Okay, body, space, and proximity. This really helps wherein, especially when you are attending to the patients who are like the pediatrics or the geriatrics or what we call the vulnerable patients, wherein you should be able to go close to them, speak to them, and convey whatever the communication that you want to do. Touch. The touch is a very, very important. You know that it is one of the senses of our body. So how you touch and how do you take care of the patient at that time will matter a lot. You see in the second video, which was just shown to you, that the way the patient was handled and the way she was just pushing her sleeves up, this was creating another communication that she is unwanted, or she is considered to be someone who is like, okay, fine, we just need to finish it off and throw you out of this particular office. So it should not happen in that way. Your personal appearance. Personal appearance is very important, because shabbily dressed people or people who are actually not dressed tidily would create a very negative impact about the patient, about the person and the organization both. Okay, eye contact. Now, if when I'm talking to you and I maintain an eye contact with you, It shows that either I'm welcoming you to talk to me, okay, and at the same time, if I am looking around while you're talking to me, or while I'm talking to you, or I'm looking down, that means either I'm not confident or I'm not interested. So your non-verbal communication shows the interest that you develop with the person in front, with whoever whom you are going to speak or communicate to. The sounds, you have heard the sound of the patient in pain, or how she was screaming, and how in the end she actually got upset on the phlebotomist. So these are the sounds of communicating that this was not acceptable to me. So there are different kind of sound. Like there are many a times when you are in a winning mood, you say hooray. When you are sad, you say alas. So, or oh, whatever the sounds that you make. So these are the sounds which show that what are you going to communicate. The silence. My silence at this moment would tell you that yes, either I do not accept what is happening, or I accept it and I do not want to discuss it further. So your silence can be taken as a communication in both the ways. It can be a positive silence also, and it can be a negative. So depending upon the situation, the silence of a communication needs to be actually inferred or understood. The third is the written communication. It's a very important form of communication. Okay, and the objective, it actually helps that the objective element of any discussion that is taking place is present, and it can be reviewed or seen and understood or transmitted. So written communication is one of the best methods of communication, but you cannot, if I want to say hello to you, it is not necessary that I should type hello. Then only will you understand. There are many things that can be verbal communication, but written communication is wherever there is some kind of a important message that needs to be conveyed across, and at the same time it needs to be maintained. Then you need to have a written confirmation, wherein at a later stage, if you need to go back to it and understand that what was mentioned in it, then you can go through it. For example, we have all these memos, we have reports, we have the office orders, we have circulars, then we have the graphs, we have the charts. Now, why do we have Levy Jennings chart? Why do we have TRF forms? Then we have emails to communicate. I can just come and I can walk into a cabin and I can talk to the doctor and say that, okay, I spoke to you on a certain so and so day, so you need to remember. For example, I always tell people, do you remember what you had for breakfast yesterday? People will say yes. Then I say, okay, fine. Do you remember what you had last week for breakfast? On say on the Monday, last Monday, what did you have for breakfast? People will not remember. But yes, if someone is charting out the breakfast, or if someone has the same breakfast every day, if I'm having bread and tea every day, then I'll say that yes, I remember, because I have bread and tea every day for the last, say, 2 years. But if I'm having different things, so there are a lot of information that takes place. Now, these information cannot all be stored in the mind that we have, because there is a lot of verbal information the ears receive and it goes to our brain. And it depends on what is going to go into our permanent memory. A lot of things go into our temporary memory and are lost. So the best way to remember things which has to be long term is through written communication. So we have the staff newsletters, we have emails, we have forms, or we have questionnaires, the letters that we send, the cards we send, the greetings we send, the calendars. Calendars are a very important part of written communication, because if you have say certain meetings, or you have certain things that need to be done, like for example, when I was a quality manager in an organization, I had a calendar wherein I used to actually put the dates for the calibration of say the pipette, or the calibration of a particular equipment, or when the preventive maintenance need to be done. So I am prepared 1 month in advance, that I know that yes, if I open the calendar for the next month, I know all of these things that are going to take place. Or there are many people in their written communication, they put up in the calendar for the dates of the webinars. That's what we do generally. So we are 1 day in advance, we are aware of it, that okay, fine, there's a webinar tomorrow. The TRF forms. The TRF form is a very important communication for us, which is actually not taken care well by most of the people. Today, through this platform, I want to tell all the technical staff and all the diagnostic center staff that TRF carries a lot of value. A small mistake in the TRF, that is the test request form, would lead to a lot of pre-analytical errors. The maximum of the errors that take place. I did a study in one of a diagnostic center wherein there were almost around 32% of mistakes in the pre-analytical due to the TRF, the wrong TRF being filled. So just imagine that if the TRF is well filled, your pre-analytical errors will automatically go down. Instruction to patients. This is also a form of communication. What happens is many times patients come. For example, if there's a patient who's coming for, say, a 24 hours urine, you give a can to the patient, and then you have the either the powder in it or a liquid which is there in it, which is for the 24 hours urine. But you have not communicated to the patient that this needs to be there. The patient feels that there is some water in it. It needs to be thrown out. We'll wash it and we'll start collecting it. So it should not happen. Or, for example, if a patient is coming, say, for comes for a pre-employment checkup, and if you don't tell the patient that there are certain things that need to be done, then it leads to either the delay or into a wrong reporting. So TRF forms and the instruction to the patients from the front desk and the technicians and even the doctors is very, very important. Once this is conveyed, a lot of pre-analytical errors will reduce. Then comes the notice, the agendas and the notes, the minutes of the meetings, the advertisements that take place. So it promotes it communicates about what are the good things that you're doing in an organization, the customer newsletters, the press release, the invitations, the leaflets, handbills, the manuals that you have, the SOPs that you have, you read through the SOPs, the work desk information, the registers like the critical alert registers that you have, the consent forms that you have. These are all forms of the written communication. Now, what are the advantages of written communication? It creates actually a permanent record. So you have something wherein you can go and refer to back. Okay, it allows you to store information for the future reference. It can be easily distributed. Whenever you are conveying something verbally, there will be a lot of distortion at each and every step of verbal communication. Like I said earlier, it becomes like a Chinese whisper. And I often, whenever I conduct a class on communication, I have the Chinese whisper game, which is there. And in one of the games wherein it said, it was like, it went totally different from saying that I mentioned that I am, yes, I am a principal assessor. Okay. And this went to the last person, and the last person spoke it out. It was, I am pregnant. So you can imagine that the difference from people conveying the message. So this should not happen. And a written communication helps in laying down the apparent principles, the policies, and the rules for running an organization. In a permanent, it's actually basically a permanent means of communication. Once it is written, that means it is documented. NABH and NABL both even talk about it. Anything that is documented should be done. Anything which is done is documented. So only the cycle gets complete when you have documented, you have done, and you have documented it again. That completes the entire, and that's how the communication takes place. That's how even NABL or NABH understands that, yes, this particular step has been completed. So it has been communicated to either the clients, the doctor, the patient, the receiver, or NABH. So thus it is actually useful as a record maintenance stuff. What could be the barriers in communication? The main barriers, what we would talk about, the three barriers are actually the external, internal, and the organizational barriers. The culture, the diversity, noise, technology, and the language. These are the external barriers to it. The internal barriers can be your thought processes, what is happening while you are conducting all these discussing or you're communicating, what are your emotions, what are your beliefs, your personal values, the poor listening skills, like you would see in the first video that we had shown, and the lack of confidence, which you could see in the second video with the phlebotomist. The organizational barriers are like the organizational policy. You must have seen in the first presentation which was there, or the video, was that when the patient asked whether they have GPay, she said, "Madam has said no." So this is an organizational barrier, which could not be, there could nothing which could be done. So these are the barriers which create a problem in the communication. The organization's rules and regulations, the status relationship, means at that particular time, at that state, what is happening, what is the connect between the patient or the provider to provider or patient to provider, and complexity in the organization structure. Many a times there is like, okay, I need to confirm, I need to revert back to you, I have to speak to my higher ups. It takes, all these barriers take a lot of time. The best way is to assign or give power to the people who are at the particular position to take a decision. So with every authority, you have a responsibility, and with every responsibility, you need to have authority. Okay. So this is all that we have talked about today for the communication. And I would request that post understanding that how one has to communicate and what are the things that really matter in communication, how the changes have taken place between the two same examples that we had talked about, 2 videos of post communication, improvement in communication. How is the situation actually handled with a troublesome client? Now you can see that there is an interest, at least with the front office person. So here you see that the communication has totally changed from the person or the patient who came was actually agitated even this time, but the person who was at the front desk very, very calmly spoke to the patient, conveyed it across, took confidence from that patient because of the 7 C's that she was considering at that moment. And since because of that interest, the patient stayed back, made the payments, and of course even went to the laboratory. And remember, last word, she said thank you. So that means she appreciated the kind of information that she got and how she was welcomed. Now the second video is again what you had seen first time with the phlebotomist versus the second time with the phlebotomist. So here again, you see that there has been a good communication between the patient and the provider. And that's how, again, the last word the patient said was thank you, which she did not express. She had expressed a lot of disagreement with the previous slide. Communication in any form does definitely help you to improve your work conditions and make things much, much better at workplace. So with this, I thank you all.
In hospital, like we face code blue situation or other critical situation. So guide us how point wise to assure communication in such a case, in code blue situation or other critical situation.
Yeah, I'm sorry, ma'am. I did not get your full question. What was the question, ma'am?
It's a question.
Okay, it's written over here. Okay, to point to assure in communication. Okay, so Hemanji, I would just like to answer this definitely over here. That code blue, and that's the reason why number one is code blue. Okay, we have the word only has been given that it needs to alert the people who are responsible, who can immediately come over there. And the moment you say code blue, the people whoever have been trained on it, that how they have to attend to that particular patient. This verbal communication later on will get converted into a written communication. But that time, verbal communication takes a spontaneous reaction, because according to the 7 C's that we have talked about, okay, about communication, there is a clarity, okay, there is a context which is to it. Now, and there is the way to communicate it, everything has been mentioned. Now, whenever you are announcing a code blue, the code blue team, the number one is that you have to train them very well. Once they are trained and everybody knows what is their responsibility during the code blue, the code blue can, once it is activated, can very well dealt with. What happens is wherever the code blue fails is because the communication either between the person who has called for the code blue, the person who has announced the code blue, the person who is supposed to reach there for the code blue, between the doctor and the nurses and the housekeeping staff. If this communication, there is any gap, that's when the code blue fails. I had done one code blue mock drill in one of the hospitals and everything was going fine till the time I was supposed to be shifted from the floor to the stretcher. And in the whole process, since the communication between two people on how to lift me was not there, the person on one side lifted me and the other person did not lift me and I fell down. So there are chances of any mishaps that take place if there is no communication between two people. Now, this could have been, of course, in a form of verbal communication. I'm not saying that it has to be a written communication, but a verbal communication between two people on how to pick up the patient and take it on the stretcher was also not there. So failure of at the right time, telling it at the right time, the communicating at the right time also leads to failures in communication and the particular situation like a code blue situation.
Thank you.
I hope it answers your question, Hemanji.
Thank you, Dr. Santwana. And like there are a lot of compliments from all the attendees for you on the presentation and how the role plays especially have made an effective impact.
And definitely this is one of the most important things which is required, which is generally ignored by most of the organizations. So through this platform, I would request all the organization and all the people from different organizations that they should have something, some information or some training sessions or some discussions on communication. This is really going to help with a lot of good work and a happy working environment for most of the organizations.
And I thank CAHO team, especially Dr. Santwana, for the wonderful presentation. And I thank all the participants for attending the webinar.